Hello and welcome, everyone. My name is Usha Runji. I am an Associate Director for Women's Health Policy at the Kaiser Family Foundation, now known as KFF. And I am so pleased to be moderating today's congressional briefing titled Unveiling the New Maternal Mental Health State Report Cards and Policy Roadmap. KFF is a nonprofit organization that serves as an independent source for health policy research, polling, and journalism. We focus on U.S. healthcare policy, particularly coverage and access to care. And over the past several years, we have seen a growing interest among policymakers on two major health policy areas, maternal health and mental health. And so I am really excited that the Policy Center for Maternal Mental Health has brought us together today to talk about this issue. It is wonderful to have such a large and engaged audience joining us today, including many members of Congress are represented as well, as this is an issue that affects all of us and all of our families. Throughout today's briefing, we invite you to ask your questions using the Q&A feature of Zoom. We have allotted time to answer questions after the presentations. So I want to start with just a little bit of context and level setting. And taking a closer look at maternal mental health. Today, we will be discussing the role of both federal and state policies, including findings from a new analysis of state-level policies. And no doubt, as we all know, the issues are quite complex, but there are lines of sight to the systems of care that are change that are needed to ensure that women and their families get the help that they need during the perinatal period. Mental health disorders are the most common complication associated with pregnancy and childbirth, affecting up to 1 in 5 women on average. Women of color, particularly Black and Indigenous women, are suffering at nearly double the rate of white women. Research shows that all women face barriers to care and that providers are also struggling to provide care that meets the needs of people for a variety of complex reasons, some of which we're going to be discussing today. Maternal mental health disorders encompass a range of disorders, including but not limited to depression, anxiety, and obsessive compulsive disorder, OCD. The spectrum can also extend to related symptoms and conditions such as psychosis, intrusive thoughts. And these disorders and symptoms can occur during pregnancy as well as the postpartum period, broadly referred to collectively as the perinatal period. When left untreated, maternal mental health disorders can have a rippling impact and devastating consequences for the mother, her newborn, her family, and society. And these illnesses are caused by a complex array, a combination of stressors that can be biological, psychological, and social, such as lack of support, a family history, or a previous experience with these disorders or trauma. The good news is that the risk for both depression and anxiety can be reduced and sometimes prevented. And with treatment, women can recover. You can learn more about background and the challenges and opportunities on the Policy Center's website, which will be dropped into the chat. I want to start. I'm happy to kick off the briefing with the video remarks from Congressmember Larry Bucshon from Indiana's 8th District. He has been an active member of Congress on issues related to maternal mental health policy.
Hello, my name is Representative Larry Bucshon, and I represent Indiana's 8th Congressional District. I am pleased to be with you today to discuss supporting mothers, healthcare providers, and states in closing gaps in maternal mental health care, an issue all of us are deeply committed to. With Indiana having the 3rd worst maternal mortality rate in the country, I was proud to introduce the bipartisan Triumph for New Moms Act, which was signed into law this past December. The bill was championed by the Policy Center of Maternal Mental Health, our briefing host today, and establishes a federal task force on maternal mental health to identify, evaluate, and make recommendations to coordinate and improve federal responses to maternal mental health conditions. The task force will release a national strategy plan to address maternal mental health, including recommendations to states and governors. I look forward to reviewing the maternal mental health state report cards that are being released. I'm particularly eager to see how Indiana scores. I invite my fellow members of Congress to join in taking a close look at the federal and state policy levers to improve maternal mental health that will be shared today. Thank you and have a great briefing.
Thank you to Congressmember Bouchon. Next, we have Ben Anderson from Families USA, who's here today to share some opening remarks. Ben leads Families USA's efforts to improve maternal and child health. He came to Families USA from the Children's Defense Fund in New York, where he managed the organization's health policy portfolio. He also worked previously as a policy analyst with the Maine Center for Disease Control and Prevention. Ben holds a BA in economics from Colgate University and a law degree from the Boston University School of Law. Ben, you have the floor.
Yeah, good afternoon. Thank you. As mentioned, I'm here today from Families USA. And for folks who don't know, Families is a leading national nonpartisan voice for healthcare consumers that is dedicated to achieving high quality, affordable healthcare and improved health for all, including maternal mental health. And Families is a proud partner of the Policy Center for Maternal Mental Health. And we're thrilled to be here for the launch of the inaugural state report cards. As a former state advocate myself, I cannot tell you how helpful this data will be to communities, providers, and state policymakers who want to tackle our nation's maternal health crisis and need better data and funding support to do it. We also know that maternal mental health is a bipartisan issue and has been a focus on both sides of the aisle. We want to thank members of Congress for your work on making permanent the option for states to expand pregnancy-related Medicaid to 12 months postpartum. And we thank you for passing the Triumph for New Moms Act through the Consolidated Appropriations Act of 2023, which will help our nation develop a national strategy to tackle maternal mental health and strategically align multiple federal programs to hone in on the issue. These are very important steps forward, but we still need more help to ensure that coverage in the states is meaningful by ensuring access to mental health care that works for moms and families. And I'm excited to hear more about that today, and I hope you are too. Thank you again for being here and for supporting our moms.
Thank you, Ben. Now I would like to introduce our speakers. I will introduce all of them now in order of their presentations. First, we are going to hear from Katrina Velasquez. Katrina is the founder and managing principal of Center Road Solutions, a nationally and internationally recognized advocate and attorney. Katrina specializes in turning partisan and social issues into non-controversial bipartisan issues and really driving them across the finish line. Katrina offers over a decade of experience in federal advocacy, grants, and law to guide clients through the federal process, including work with the Department of Justice, Health and Human Services, Homeland Security, as well as several political campaigns, law firms, and nonprofits, including those that support maternal mental health, such as the International Organization for Migration and Sandy Hook Promise. Katrina will be providing an overview of federal maternal mental health policies today. After Katrina, we will be hearing from Caitlin Murphy. Caitlin is a research scientist at the George Washington University Milken Institute School of Public Health, where she is currently a doctoral student in health policy. She brings more than a decade of experience using mixed methods research in public health, health policy, and health systems, and how they intersect maternal and child health and family health. She brings content expertise in a variety of disciplines, including mental health, trauma, and social determinants of health in the healthcare setting. Caitlin has a master's degree in public policy analysis from NYU's Wagner School, and she served as the project consultant for the inaugural mental health report cards, which she'll be presenting today. And then finally, we'll have Joy Burkhardt. Joy is the founder and executive director of the Policy Center for Maternal Mental Health, formerly known as 2020 Mom to Many. Joy spent 24 years working for the health insurance company Cigna Healthcare in the quality management and legal departments. She has a passion, as many of you know, for quality and innovation, and really believes that the healthcare system should work for all of us, regardless of where we live or the insurance coverage we have. Joy is known as a cross-sector collaborator, as well as a fierce advocate of our largest healthcare consumers, mothers. She has been recognized for her leadership and vision with many awards, including APHA's Maternal Child Health Leadership and Advocacy Award, and the Emerging Leader Award in Women's Health from Federal Health and Human Services, Office of Women's Health, just to name a couple. Joy will be highlighting priority policy opportunities for improving maternal mental health outcomes. After all of the speakers have had a chance to make their presentations, we'll turn it back. We'll open it up for Q&A. So please remember you can drop your questions into the Q&A throughout the course of the briefing. So welcome to all of our panelists, and I am going to turn it over now to Katrina.
Great. Thank you, everyone. It's such a pleasure to meet you. And, looking forward to walking through all of the amazing things that Congress has actually done this past year around maternal mental health. And then also offer you up some opportunities that you may have for those of you who are congressional staff. So the first thing which, Dr. Bouchon mentioned was the Triumph for New Moms Act. And this was actually passed at the end of last year in the Omni. And so as part of the bigger mental health package, they had different names on each chamber, but it was included in. And really kind of the goal of the Triumph for New Moms Act is to create a federal interdepartmental task force to do a landscape review of federal maternal mental health activities, as well as identify gaps and make policy recommendations to both the federal government and then to state governors. This actually, from what we're hearing, has commenced. So we are very excited about this. They have a solicitation out right now looking for organizations and stakeholders to participate in this task force. So those of you who may be interested, definitely submit. I believe the deadline is May 31st. And then also a huge thank you to the advocates and the congressional champions that got this across the finish line. Here, the Policy Center for Maternal Mental Health was a huge part of passing this, as well as Dr. Bouchon, Congressman Berrigan, who else? I believe there's so many, Senator Hassan, who else? Senator Tillis. My brain is kind of itching me. There were so many. There was a wide variety of members of Congress and senators who got this passed, and it was really a bipartisan effort. Next slide. The next big thing that passed, so that was kind of the big structure of kind of pulling all the pieces together for the federal government. And then the next is really helping moms to get help. So this was a provider screening and intervention for moms, and it was actually a reauthorization of what was passed in the 21st Century Cures Act. And so what it did was it passed the Into the Light for Maternal Mental Health and Substance Use Disorder Act in the end of year package. It authorized additional funding and another 5-year continuation for these grants. So the original authorization in 21st Century Cures was for $5 million each year. And then the authorization actually increased up to $24 million in this reauthorization. And the reason is that the bipartisan groups of members of Congress, who included Congresswoman Clark, Congresswoman Herrera Butler, Congressman Burgess, and a variety of other members, as well as folks on the Senate side, like Senator Capito, Senator Gillibrand, Senator Murkowski, et cetera, what they really learned was that there was such a great amount of success in these grants to states, because what the states were doing were they were in essence providing a psychiatric access line. So this was really helping providers, so say your OB or your midwife, who may be noticing warning signs of maternal mental health conditions, to kind of phone a friend, call a psychiatrist within their state, and then actually kind of get some tips on how to best treat that person. So they wanted to really make sure that more states had the opportunity to have grants just like this, as well as other coordinating and awareness activities. So hats off to all of the members of Congress who got this passed, and for the Maternal Mental Health Leadership Alliance for leading this legislation. Next slide. Another great thing that was also part of the Omni, we felt like it was a little bit of an Oprah situation where everyone was getting some fun stuff here, was the authorization of a 24/7 hotline for moms. So this is the Maternal Mental Health Hotline. It was actually originally created in the FY21 Consolidated Appropriations Act, and this officially authorized it so that it would continue forward. So the authorization was for a 5-year period for $10 million a year. And really it expanded the services of the Maternal Mental Health Hotline to include not only maternal mental health, but also maternal substance use disorder. And then it coordinates with other federal hotlines like 988, the Domestic Violence Hotline, the Veterans Hotline. It includes different cultural competency like for service members, vets, mothers of color, etc. So this was another great piece of legislation, also led by the same folks who led Into the Light, which we just talked about. And it provides 24/7 help from actually counselors on the other line. And you do this via phone and via text. So if any of you are moms out there, late night feedings, how important it is to have your hands, not wake that baby and you could be able to text. So this was one of those great elements there. And then as well, the hotline in FY23 was funded at $7 million. This was about a $3 million increase from the previous year, and really focused on increasing those public awareness activities to ensure that moms and families knew about the availability of help. So again, congrats to MMHLA for helping all these amazing bipartisan members of Congress get this across the finish line. And then the final thing that occurred last year was in the FY 2023 package that also passed at the end of the year, included $7 million for the Office of Minority Health to have grants to community-based organizations to really help diverse moms at the community level. So this was a really kind of new and big piece to really kind of get on the ground where those moms are. We're actually hearing that this grant should be available for folks to apply to on May 15th. I'll put it in the chat box so that you guys can have it. But we're really excited that this is coming forward. And also we're really excited for the members of Congress who led this, like Lisa Blunt-Rochester and Senator Gillibrand, as well as for pushing the administration to apply the congressional intent for the application. So we're really excited for this, and hats off to Shades of Blue Project for really leading this into passage last year. So kind of looking forward into this Congress and really what's ahead, there are always these great opportunities for maternal mental health. Just kind of not only on the physical health side, like thinking about maternity care, but also on the mental health and substance use disorder side. So, some areas that we're seeing Congress enter into and we're working on include maternal mental health in the military, particularly for service members and their spouses. There was a great GAO study released just last summer that actually showed that service members and their spouses had higher rates of maternal mental health condition, about 1 in 3. As well, increasing funding for provider trainings and the Maternal Mental Health Hotline. Those two elements on the state grants and the hotline, that is another FY24 ask for this year. And then also ensuring issues around maternal health and maternal mental health are included, including those perspectives of diverse communities, because they do affect diverse communities a bit differently than that general population. And then there's much more. There are always opportunities out there. Slide. Great. Thank you so much. I'll pass it to Caitlin Murphy from here.
Great. Thank you so much, Katrina, and good afternoon, everyone. My name is Caitlin Murphy, and I'm a research scientist at the George Washington University Milken Institute School of Public Health. And this afternoon, I am so excited to share with you an absolutely essential new project that the Policy Center for Maternal Mental Health has been working on in collaboration with the George Washington University, the Maternal Mental Health State Report Cards. Next slide, please. For the next few minutes, I'll be answering 3 questions. First, what are the maternal mental health state report cards and why were they developed? Second, what measures and methods were used? And third, what states are emerging as our top performers? Next slide, please. As we've already heard today, the scope of maternal mental health need is massive. Maternal mental health disorders impact 1 in 5 mothers in the US. And even more striking, mental health conditions are actually the leading cause of maternal mortality in the US, with nearly 1/4 of maternal deaths resulting from suicide or overdose. We also know that screening is not occurring. Over 50% of maternal mental health disorders are going undiagnosed. We also know that treatment is not occurring at the rates that it needs to. Only 15% of mothers who need treatment actually receive it. And critically, we know that filling these gaps is not only a matter of life and death, but foundational for children to thrive. And despite all of this knowledge and these massive gaps, before today, states have not yet been scored on their efforts to address maternal mental health. A scoring structure can help provide credit to states for the hard work they are doing in this area and point to areas where states can improve. Next slide, please. So, launched today, the inaugural Maternal Mental Health Report Cards use 17 key measures to provide a snapshot of state efforts to fill the massive gaps in maternal mental health services that we're all aware of. These measures span 3 dimensions of maternal mental health, with the recognition that more dimensions can be added in the future. First, the report cards include 6 measures of maternal mental health providers and programs. For example, do states have enough therapists and psychiatrists with specialties in maternal mental health? And do states have community-based maternal mental health resources? Next, there are 6 measures of maternal mental health screening requirements. For example, do states require providers to screen for maternal mental health, and do they reimburse for that screening? And do states collect data on this screening? Third, there are 5 measures of maternal mental health coverage and treatment. For example, do states cover maternal mental health services for those who need it the most? And what efforts do states make to ensure that maternal mental health services are high quality? Across all of these dimensions, we're really trying to highlight the depth of maternal mental health service shortages and what states are doing to address this. Next slide, please. So how were these measures chosen? A very high-level overview can be found on the slide, and then much more detail can be found on the Policy Center's website. First, the Policy Center NGW identified all available state and county level data sets that might be relevant to maternal mental health. Second, using these data sets, we developed 17 discrete state measures across those 3 measurement categories that I just mentioned. And as also mentioned, we will keep adding categories and measures as more data becomes available. Third, states were awarded between 1 to 3 points for each measure based on their performance on the measure. And last, states with the most points were identified as top performers in their efforts. And we'll be highlighting some of those top performers in just a moment. Next slide, please. It's important to note that we're considering the 2023 state report cards to be preliminary. There are many, many data points that the Policy Center knows are relevant to maternal mental health and hoped to include in these report cards, but either A, the data isn't available, or B, the data is not available just yet. Among the data that is available, we included measures we believe to be the most important to maternal mental health. It's the Policy Center's hope to keep incorporating new measures into the report cards as data becomes available. For example, we'd like to include measures such as state requirements that health plans report on the new HEDIS measure of maternal mental health screening, which states are just starting to roll out. Other measures could also include state efforts to cover maternal supports such as doulas, peer supports, and community health workers, which states are making a lot of progress on. State efforts to fund community-based organizations that provide maternal mental health services, or state requirements that maternity providers receive implicit bias training. We know the extremely negative impact that racist interactions have on maternal mental health and quality of care. So the goal with this kind of measure is to understand state efforts to address racism in maternity care. Next slide, please. The Policy Center envisions multiple uses for these report cards, such as education and coalition building, advocacy and policy making, and benchmarking of state progress, since the goal will really be to update these cards annually. Next slide, please. Now I'm going to take the next few minutes to just briefly walk through those 17 measures that were included in the 2023 report cards. And in the process of walking through these 17 measures, hopefully it will also help illustrate just how many approaches states can take to address maternal mental health. Next slide, please. First, we have two measures looking at a state's maternal mental health provider-patient ratios. We know that access to specialized care is one of the largest barriers to maternal mental health care, so we consider these measures absolutely critical. The gold standard of this specialized care is the perinatal maternal mental health certification, or the PMHC, which is a credential that's currently promoted by Postpartum Support International and ensures that a mental health specialist has been trained and tested in addressing maternal mental health disorders, such as postpartum depression and anxiety, which show up very differently for mothers than for the general population. And we've considered states to have enough PMHC providers if there are at least 5 PMHC providers to 1,000 maternity patients. And this was calculated based on the ratio of patient need in a number of hours that the number of hours that a PMHC provider can provide in a year. In only 2 states, Montana and Vermont, there is currently an adequate ratio of PMHC providers to maternity patients. Our second measure was created similarly. Does a state have at least a ratio of 1 maternal mental health prescriber per every 5,000 maternity patients? And we're defining prescriber here as someone that can prescribe medication for maternal mental health disorders and has received specialized training in doing so, even if they haven't completed the PMHC certification. This category includes providers such as psychiatrists, psychiatric nurse practitioners, as well as some certified nurse midwives and others. And we see here that 11 states have met this ratio of 1 maternal mental health prescriber to 5,000 maternity patients. Next slide, please. So combining those 2 measures that I just mentioned, we see that only 1 state, Montana, currently meets both provider-patient ratios. While Vermont and Montana meet the PMHC ratio and 11 states meet the maternal mental health prescriber ratios, only Montana meets both. Next slide, please. Next, we know that for some mothers, a weekly or biweekly meeting with a therapist or a prescriber simply isn't enough, and more intensive treatment is needed via inpatient or outpatient maternal mental health treatment programs. As such, 2 additional measures were added. First, does a state have an inpatient maternal mental health treatment program? We know that California, North Carolina, and New York do. And second, does a state have an outpatient intensive or partial hospitalization maternal mental health treatment program? These programs can also be found in California, North Carolina, and New York, as well as 11 other states. Next slide, please. In total, we see that only 14 states currently have at least 1 maternal mental health treatment program, and some states do have more than 1. States were awarded additional points for each additional maternal mental health program they have, capped at 3 points total. Next slide, please. Next, we wanted to understand if states have taken efforts to create a strategic plan and provide community resources to address maternal mental health. We see that 7 states have either formed a task force or a commission to create a strategic plan on this topic. And we also see that 22 states have at least one community-based organization per 50,000 births providing direct maternal mental health services. It's important to note, however, that this measure is very preliminary and should not be considered as reliable for 2023. And this is because there currently is no extensive list of community-based organizations providing maternal mental health services. And the list that does exist was created by the Policy Center. The list created by the Policy Center is the best that we currently have, and it will continue to be updated over time. And in fact, we warmly welcome you to submit any submissions you feel like more will be relevant directly through the Policy Center website. Next slide, please. Next, I'll be sharing a few measures regarding state progress towards maternal mental health screening and screening reimbursement, knowing that we are still a very long way from universal screening. One of the most powerful ways that states can ensure screening is by making it a requirement for providers. In 4 states, California, Illinois, Louisiana, and New Jersey, OBGYNs are currently required to screen for maternal mental health disorders. Next slide, please. States can also ensure screening by making sure that providers are getting paid for it. For Medicaid populations, 7 states were found to have the clearest and most thorough requirements that OBGYNs are reimbursed for both prenatal and postpartum maternal mental health screening. And when we turn to the private insurance population, we were able to look at how frequently providers are actually billing private insurance for maternal mental health screening via private insurance claims data. Perhaps unsurprisingly, private claims for screening were quite low. In only 2 states, Colorado and Indiana, did more than 1% of patients' OBs bill private insurance for screening. And we also found that there are 0 states where more than 3% of patients' providers bill for screening. This shows us that from a private insurance claims point of view, reimbursement for screening is really not occurring. Next slide, please. Our last measure on screening looks at state progress on data collection. As folks may be aware, as of 2019, the HEDIS measure set now includes 2 measures of maternal mental health screening. First, if maternal mental health screening and follow-up is happening during the prenatal period, and second, if maternal mental health screening and follow-up is happening during the postpartum period. Currently, these measures aren't part of the mandatory HEDIS measures that health plans are required to capture to stay accredited. However, 8 states require their Medicaid health plans to collect these measures. And in fact, Indiana ties payment to performance on this measure. Since these measures are relatively new, we expect more states to take up these measures in the coming years, especially since performance measures are a very powerful way to ensure that their health plans are performing on maternity services. Next slide, please. Our last measure category looks at state efforts to ensure coverage of maternal mental health services and the provision of treatment for those who need it. Under this category, we included 2 measures to understand if a state is making service coverage available to those who need it most. First, has the state expanded Medicaid? We know that in this case, 40 states plus DC have. Second, has the state extended Medicaid postpartum coverage up to 1 year postpartum? This is the case in 38 states plus DC. Next slide, please. In the provision of maternal mental health services, 2 states have taken an extra step to ensure that those services that are being provided are high quality. In both California and Louisiana, these states require that all health plans develop a maternal mental health quality management program. Next slide, please. Last, we wanted to understand the rates of maternal mental health treatment and provider reimbursement for treatment. And while this type of information wasn't readily available for Medicaid populations, this is something we are hoping to include in the report cards in the future. For now, the Policy Center looked at private claims data to understand how frequently providers are billing for maternal mental health treatment. We found that in only 3 states, Massachusetts, Rhode Island, and Vermont, over 15% of prenatal patient providers billed private insurance for mental health treatment. And in only 1 state, Rhode Island, we saw that over 15% of postpartum patients providers billed private insurance for mental health treatment. Considering that 1 in 5 mothers experience a mental health condition, we know that these rates of patients receiving and providers billing for treatment can improve. Next slide, please. Okay, moving on to the grades. Next slide, please. After lots of careful checking and double checking, all 17 measures were tallied up for each state. And in our first category, maternal mental health providers and programs, we see that states with some of the highest scores are out west: Montana, Oregon, California, Arizona, and New Jersey. And as a reminder, these are the states that are receiving points for having adequate provider-patient ratios or treatment programs or adequate maternal mental health community-based resources. Next slide, please. In the second category, maternal mental health screening, we see the highest scoring states again out west, with some Midwest representation as well. This includes Oregon, California, Colorado, Illinois, and Indiana. And these are the 4 states receiving the most points for having the clearest and thorougest requirements for maternal mental health screening and reimbursement. Next slide, please. In the third and last category, maternal mental health coverage and treatment, we see California again as a top performer, as well as Louisiana, Vermont, Massachusetts, and Rhode Island. These are the states gaining the most points for maternal mental health service coverage and ensuring service quality. Next slide, please. After combining the scores for all 3 of these categories, each state was given a total score and an associated grade. For the 2023 report cards, we see that 42 states in total received a D grade or lower, for a total US grade of a D. For only 1 state, California, this state received a B-, and we know this is due to significant recent philanthropic, legislative, and advocacy efforts that have occurred in maternal mental health in the state. These grades might be surprising to some or unsurprising to others, but what this really provides us is a benchmark understanding of the depth of gaps and where progress has also been made. Next slide, please. Breaking down that previous slide, we see that 9 states are our top performers, meaning that they scored a C- or above: Oregon, California, Arizona, Colorado, Illinois, Pennsylvania, Massachusetts, Rhode Island, and New Jersey. And again, we see California as our highest scorer, primarily due to recent efforts and investments, specifically in maternal mental health. Next slide, please. We also see that 16 states receive failing grades. We see these primarily showing up in the South and the Midwest, with a few New England states falling into this category as well. Next slide, please. Seeing these grades, we know that one of the first questions that folks will ask will be, what's driving these grades and what can be done? This is why we want to be very transparent regarding the measures that went into these grades, and each measure will be available up on the Policy Center website. The measures were also intentionally designed to be action-driven. Each measure is something a state can take action on to improve maternal mental health screening and treatment at the state level. For example, several states lost points because, 1, the state did not have enough therapists or prescribers with specialties in maternal mental health disorders. 2, the state lacked maternal mental health treatment programs and community-based maternal mental health resources. 3, the state does not require providers to screen for maternal mental health disorders. Or 4, the state does not hold health plans to quality standards regarding maternal mental health services. But in each case, there are concrete steps that can be taken to improve patient-provider ratios, build out treatment programs and community-based resources, and put requirements into place regarding maternal mental health services. And Joy Burkhardt, the CEO of the Policy Center, will touch on this next. Next slide, please. So, how do you get your state report card? Next slide, please. In terms of next steps, we encourage you to go to the Policy Center website at statereportcards.mmhmap.com and look closely at your state's report card. On the report card landing page, you'll be able to click into your state, and an interactive and PDF version of your state report card will be available. Next slide, please. For each state, you'll be able to review which measures your state received credit for or which measure hasn't been met yet. Here, you can see all 17 measures and where DC, for example, met or didn't meet a measure. Next slide, please. Also, for each state, you'll be provided with a summary of your state grade in each category: providers of programs, screening, and coverage and treatment, as well as your state's overall grade. There are also buttons available right on the report card that will help you share this page with others, and we highly encourage you to do so. Next slide, please. Last, I want to turn it over to Joy Burkhardt, the CEO of the Policy Center for Maternal Mental Health, who is going to take the next several minutes to walk through a newly released resource that provides concrete steps that states can take to improve their score and address maternal mental health in their state, the Maternal Mental Health Policy Roadmap. And Joy, I'll turn it over to you.
Wonderful. Thank you so much, Caitlin. And I wanted to take a moment before we dive into the roadmap to thank the team that's developed these critical report cards, and also to the funder who wishes to remain anonymous. We thank you for investing in this critical work. We believe that it's truly going to change outcomes for mothers and children across the United States. A quick thank you not only to Caitlin, who you just heard from, but also Adam at Clue Research, and also Rebecca Britt, the Policy Center's Director of Impact and Research. Thank you. Next slide. So a little bit about the Policy Center for those of you who haven't met us yet, before I dive into the roadmap. The Policy Center's mission is to close gaps in maternal mental health care. And we do this by informing public policy, like we are doing now, and also informing healthcare practice change policy. We work across sectors to catalyze change by convening various stakeholders and supporting them in their work. Wanted to talk a little bit more about the roadmap and first acknowledge that we know this is a shared responsibility of federal and state policymakers, those of you on the line today, including healthcare providers, hospitals, insurers or payers, and communities. Together, these players can take steps to prevent maternal mental health disorders and to close gaps in care. This roadmap that we're presenting today provides the way forward. And today we'll be focusing on two components of the roadmap: the recommendations for states, as Caitlin alluded to, and we also have recommendations for federal policymakers in addition to the policy that Katrina shared earlier. Next slide. Wanted to start by acknowledging that states are really where the rubber meets the road when we talk about health policy, as many of you know. And we're very excited that more and more states are beginning to take regulatory and legislative action to improve maternal mental health. Some of these actions include declaring May Maternal Mental Health Awareness Month, mandating screening, which we heard Caitlin talking about as a component of the report card scoring system, and also state Medicaid agencies starting to take action around reimbursing obstetricians and pediatricians for screening, for example. You can view the model legislation and also all of the actions that states have taken that were legislative in nature on our website, and we'll be dropping that link into chat. Next slide. So we're going to go over quite a few state opportunities here, and we wanted to start by acknowledging that not only do we believe it's important for the federal government to form a cross-sector commission or task force, which is happening under the Triumph for New Moms Act, but states can play a role in forming commissions and task forces as well. Why is that important? Though there are some barriers that are not unique to states and across state lines, many challenges are state-specific, as you might believe, and it takes cross-sector leaders from state healthcare professional associations, government agencies, insurance companies, hospital associations, and of course, mothers with lived experience to really get to the root causes of poor outcomes in states. These commissions and task forces can be formed at the urging of the governor, by the State Health and Human Services Agency, or a delegated agency within HHS at the state level, or of course by the legislature. We have model legislation, model agendas for such task forces, and also template reports available through the Policy Center. Next slide. Declare the month of May Maternal Mental Health Awareness Month. This is a simple step that can help raise awareness among the provider community, the public, and of course, among mothers and families. And legislators and/or governors can issue proclamations or resolutions declaring May Maternal Mental Health Awareness Month, or even just the first week of May, like this week, Maternal Mental Health Awareness Week. There are ideas here on this slide that tie into work around developing awareness campaigns, including promoting the international symbol, the blue dot, for example, and also including the new maternal mental health hotline, for example, as a resource in awareness campaigns. Next slide. Another important opportunity, which Caitlin hit on and is addressed in the scoring methodology for the report cards, is that Medicaid agencies can require health plans to report maternal depression HEDIS measures. It's been recommended just last week by a work group that advises the Centers for Medicaid and Medicare Services that the 2025 CMS adult core set mandatory measures include the HEDIS postpartum depression screening measure, and states can require reporting prior to 2025. As you saw the list previously of the states that are already doing so, and we applaud those states. And they can also require that the depression screening during pregnancy measure be mandatory in their states. And of note, Caitlin addressed this briefly in her remarks, but we're also starting to see in these reporting years that NCQA is requiring commercial insurers to report these measures as well, which is fantastic. Next slide. Medicaid agencies can promote reimbursement strategies for maternal mental health screening for obstetricians and midwives. And why is this important? Many of you know that CMS several years ago issued guidance to the state to address how they could reimburse pediatricians for postpartum depression screening. And many of you know that now the research is really highlighting that it's just as important to address maternal mental health disorders that onset in pregnancy, or even those that onset prior to pregnancy but are not treated appropriately or with proper outcomes. So through the focus of research and therefore programs and initiatives, postpartum depression, as I mentioned, was first addressed in the federal infrastructure around reimbursement for screening. And now we know again that postpartum depression onsets almost as frequently, or depression in pregnancy rather, onsets almost as frequently in pregnancy as in the postpartum period, and can lead to poor birth outcomes, including high rates of preterm birth and low birth weight deliveries. Medicaid agencies can recognize the importance of screening to detect these disorders by obstetric providers, OBGYNs, and midwives, and reimbursing them for their efforts outside of the maternity care capitation rate or within the maternity care capitation rate. But it's critical, we believe, that states take action to address reimbursement. Next slide. States can also require that health plans and insurers, including commercial insurers, develop quality management programs. Those of you who have experience in health delivery know that quality management programs are created by plans and insurers and required by NCQA, the accrediting body, and others, including some states. And they're critical for monitoring the delivery of care in the US, including the delivery of services. when results don't meet the standards that plans set or that the states may set for the plans, interventions are implemented to improve performance and outcomes. We think it's critical that plan quality management programs be developed by health plans and commercial insurers to improve outcomes for maternal mental health. And you can see some of the ideas listed here that could be adopted as interventions. More interventions are suggested on the full roadmap on our website. Next slide. States can propel the use of certified peer support specialists for maternal mental health. All states in the United States, which is remarkable, I'll say it again, all 50 states now have a state-sanctioned certified peer support training and certification program, and many reimburse state-certified peer support specialists. However, states which developed these programs years ago, who are really the pioneers, may have only addressed the use of certified peers for substance use disorders or even serious mental illness. In that case, these states could close the gaps in programs to expand testing, training, and reimbursement for the provision of mental health services, such as providing support for those with anxiety and depression. States could recognize the value of peer support services for the maternal population as well, and work to deploy them in clinical and community-based settings to immediately expand the behavioral health workforce and provide culturally competent and approachable services to mothers and expectant mothers in need. I also just wanted to add that the Policy Center is working to provide an add-on maternal mental health training with one of our sister nonprofits for those who are already certified as peer support specialists in their state. Next slide. We also believe it's absolutely critical that community-based organizations who are providing services, including support groups, for example, or even clinical services, but are nonprofit organizations, be lifted up as important resources, particularly in light of a crisis around shortages and also in light of challenges around delivery of care for Black and Indigenous and other people and women of color feeling safe and heard in the medical system. We believe that states, through legislative and/or agency-based services, can support existing nonprofit community-based organizations and also support the development of new CBOs through offering grant programs and training on things like how to become a billing provider in the state if clinical services are provided by the nonprofit, how to hire and supervise certified peer support specialists, for example, and what billing codes to use for certified peer support specialists. These are basic supports that really could transform the way care is delivered in a state. Next slide. And the last recommendation for states is to require health plans and insurers to cover group maternity care classes and services, birth and postpartum doulas, and also home health nursing care for maternity. Group maternity care programs such as the Centering Pregnancy Program, which many of you may know, and also certified doulas offering support during pregnancy, so pregnancy and labor and delivery, so birth doulas, and certified doulas offering postpartum home care, as well as home health nursing care, should be covered by insurers, both private and public. Birth doulas provide education and about staying healthy in the birth process and serve as an interface between medical providers as needed, and particularly during labor and delivery. Additionally, Medicaid and commercial insurers should cover postpartum doula coverage as well in home settings. These doulas offer holistic care for the entire family, including the infant, during the postpartum transition. And it's really important to support things like infant sleep, breastfeeding, and more that become triggers for mothers in suffering from maternal mental health disorders. And then finally, we believe that nurse home visiting coverage should be provided as well, particularly for women who've had complications and infants who've had complications. Next slide. I now want to move on to a few of 5 federal opportunities. And we, again, want to acknowledge all of the congressional staffers that are with us today. Thank you for being here and really taking this work seriously. We and our other nonprofit partners will be here to support you in your work on the Hill. So for those of you who are trying to understand, well, states largely have jurisdiction for the health delivery system. What can the federal government do? And there's quite a bit. We heard about some of that already from Katrina. The federal government provides national Medicaid infrastructure, as we know, through CMS, preventive supports. I saw a colleague here from HRSA who offers quite a bit of preventive support programs, technical assistance programs through agencies like SAMHSA, and then funding to states through grants. Current maternal mental health specific programs, examples of those programs include HRSA's maternal mental health grants to states to develop and support improved screening and outcomes, and also the National Maternal Mental Health Hotline, which we've already talked about. Next slide. So opportunity number one, we actually believe, along with some of our partners, that it's time to expand PCP and obstetric care provider capacity by actually creating a national consult service, which we like to call a provider 988, recognizing that it can take years and years and years for all states to develop these types of services, even with financial support from the federal government, that it's critical to think outside of the box and start to think about offering this as a national service to all states. More specifically, a national consultation line provided to PCPs and obstetric providers, not unique to maternal mental health, but specific, but also inclusive of maternal mental health disorders, could provide access to mental health experts, including psychiatrists, to discuss a patient's mental health and medication usage, either existing medication or changes in medication that are being proposed or considered. These services would also support mental health, frontline mental health providers like PCPs and OBGYNs in developing a preliminary diagnosis, help them with screening when there's questions about what screening tools to use, for example, and initial treatment plan development. This program could be modeled after HRSA's AIDS National Clinical Consultation Center, and we include a link here. Next slide. Recommendation 2, create the National Maternal Mental Health Task Force and strategic plan. This work is already underway, as we've heard already, through the passage of the Triumph for New Moms Act, but we also just felt compelled to address it again because we know that there are many competing priorities and a lot of work that is happening at a national level. And so we applaud HHS, who I believe is with us today, and also SAMHSA, the agency that HHS is delegating this important work to, for their efforts already underway to form the task force. We included some examples of strategies that might be noted in a national or national strategic plan and recommendations to states as well. Some of that is here, and there's more detail on the website recommendations. Next slide. Create and expand behavioral health care professional training programs targeting the HRSA behavioral health shortage areas. According to HRSA, as of May 2023, this month, 163 million Americans live in a shortage area with for mental health professionals, and there is a need of an additional 8,000 mental health providers in the U.S. to cover that gap. The federal government can take immediate and timely action by providing funding for education and training to individuals who spend a minimum number of years working in shortage areas. Further funding should be prioritized to diversify the mental health workforce and also support high need populations like children and mothers. Next slide. Number 4, the Department of Labor, who has jurisdiction along with a couple of other federal agencies, should require creative solutions among health plans and health insurers to address mental health parity. The Department of Labor's EBSA division has the authority to ensure all Americans have access to mental health and substance use disorder benefits. However, actions are not being taken quickly enough to require America's health plans and insurers to comply with the Federal Parity Act. This is in part because plans and insurers believe their hands are tied with regard to shortages of providers. However, creative solutions are available, including solutions like contributing to a federal fund to build the mental health workforce. You can learn about our detailed recommendations and solutions on our website, which is linked here, and we will be providing these slides post-webinar. Next slide. The last recommendation from a federal perspective is to ask the Women's Preventive Services ask that the Women's Preventive Services Guidelines be updated to incorporate maternal mental health screening and intervention. Many of you may know that those recommendations are currently covered under the U.S. Preventive Services Task Force recommendations, and that those recommendations are under threat. The Health Resources and Services Administration, HRSA, has guidelines available for women's preventive services, which haven't needed to address maternal mental health because the U.S. Preventive Services Task Force guidelines did. However, we're recommending that the Women's Preventive Services Guidelines be modified to include these recommendations previously covered under the U.S. Preventive Services Task Force. We list here a few examples of interventions that should also be included in the Women's Preventive Services Guidelines. Next slide. One last very critical opportunity that's not unique to maternal mental health, but would certainly improve maternal mental health outcomes for parents, as research clearly points out, that paid family leave should be made available, and specifically be made available to parents. First and foremost, Congress should pass a paid parental leave program as soon as possible. Paid leave has been associated with improved maternal mental health and improved maternal health outcomes, and providing these benefits on a federal basis will ensure that small to mid-sized businesses and organizations can compete with large employers for the best talent, and that the benefits are available to all American families, regardless of where they live and where these families work. And with that, I'm happy to turn it back over to Usha. And again, we're very excited to have all of you with us today, and we're going to turn it over to Usha to moderate our Q&A.
Thank you, Joy. Thank you, Katrina and Caitlin, for just a wealth of information. We have about 15 minutes for Q&A. Thank you for all the questions. I'm seeing them in the Q&A. Feel free to continue adding, and we will try to get to as many as we can. I'll invite all the panelists to turn on your cameras. Have everyone back. Great, thank you. And while everyone's coming back, we have a number of questions already, and so I'm going to jump in with the first one to start with for Caitlin. Caitlin, what a tour de force of research that you have conducted and led over the past several months, and also presented in a matter of minutes. Thank you. What a few questions. I wanted to give you the opportunity to just expand a little bit more about your research process. A couple of questions that came up around, how do you compile all these different data sources? And then there were a few specific questions that came up around the sort of provider category, and how do we, what can we do to ensure that the range of providers in maternal mental health are accounted for in these kind of report cards?
Yeah, that's great. Thank you so much, Usha. So it really was a team effort and a months-long effort to pull all of these data sources and measures together. So it involved first a very large landscape analysis of all of the sources that are out there regarding state efforts and performance on maternal mental health, with the huge caveat that there is a lot of data that isn't yet there. And so that's part of what we spoke to today, is the need for more data collection and for states to prioritize that data collection. So from the data that is available, we pulled from a wide variety of data sources, and you can find in very explicit detail each one of the data sources, so the data set itself and the item at the item level for each measure on the Policy Center website. If you go to the report cards, there is a hyperlink there that says learn more about each one of our measures, and we tried to be as transparent as possible on all of these measures and their data sources. But just to touch on a few, first, when it came to providers and treatment programs, we did partner with Postpartum Support International regarding their provider registries and treatment program registries. I'm going to ask Joy if she perhaps could weigh in as well on the piece regarding future development for pulling in more providers providers beyond just the PSI registries, because I know that has been one of our biggest challenges, is identifying the full scope of providers out there. And to my understanding, this hadn't quite been done yet, bringing together all of these providers and putting these ratios together. So Joy, I don't know if you want to speak a little bit more to that.
Sure. Yeah. And you'll see we dropped into one of the questions, an answer with a link to the measures that were developed, including the data sources. And as Caitlin addressed here, we lean on specific organizations' data sets for each of these measures, sometimes develop them on our own, including the community-based organization data sets. But for providers specifically, we will rely on the Postpartum Support International data sets. That includes their PMHC certified providers, so perinatal mental health certified providers, which are really the gold standard to ensure that providers have been not just trained, but also tested for proficiency to ensure that the knowledge is retained, the right knowledge has been trained, for example, and that the provider really is ready to serve this important population. So the PMHC data set is one data set, and then prescribers were pulled separately. We do know that many MDs have specialized training as reproductive psychiatrists, but wouldn't necessarily get a perinatal mental health certification. And so a separate data set was pulled from Postpartum Support International for those who have personally attested to training, for example, as reproductive psychiatrists, or nurse prescribers, for example, who've had specialized training in maternal mental health.
Yeah, great. Thanks, Joy, because I know that was one of the more challenging pieces, was identifying all of the range of providers. And then also in terms of other data sets, regarding state requirements and legislative action, we tapped into the Kaiser Family Foundation legislation trackers, the Commonwealth Fund legislation trackers, as well as the National Academy for Health Policy trackers. So really trying to get a broad scope of tracking what's going on at the state level. And then we also were able to tap into claims data from Fair Health, which is actually the largest source of private claims data in the US. And as mentioned in our presentation, our goal in the future is to also be able to pull in claims data regarding Medicaid claims, but we were not able to receive that data in time for this report card release. So those are some of the biggest data sources that we have used. But again, the goal will be to continue to bring in more data and more data sets for future iterations of the report cards.
I'll also add that the Policy Center for Maternal Mental Health does also have a state policy tracker for legislation that's passed in every state. We'll make sure that we share that here as well. So we invite you to take a look there. And then we'll be launching a state policy tracker that tracks live policy as it's being introduced and moved through current state legislatures. Hopefully this year that will be launched. So more to come on that front.
Great. Thank you so much to having more information, and also knowing that this is going to continue to grow and be refined is really exciting. There are a couple of questions. I think maybe Joy, maybe you want to start around the sort of theme of community engagement, but anybody's welcome to weigh in. One of our questioners asked about the very real issue of stigma and fear, particularly among communities of color. Around being among moms for being identified for having a mental health condition and treatment by the criminal justice system. How do we address that? And where does that come into play in this constellation of issues? And along those same, sort of related, I know you mentioned that Caitlin mentioned during the presentation that she relied on the Policy Center's, the only database around current state programs and community-based programs out there in maternal mental health. How do we grow that? And are there other ways for states to be able to improve and meet their own measures? So I don't know, Joy, if you want to start, and if anybody else wants to jump in, please do.
Yeah, that's great. I think Caitlin and I can both take the question around measures and how do we account for safety in the health delivery system, and hopefully expanding the health delivery system to include community-based organizations. That's a top priority for our organization. As you can imagine, there haven't been real data sets that we are aware of in our search that account for those things quite yet, but we believe there's a lot of change happening, federal and state level to account for efforts like this to ensure that the right type of care is provided. And so as those of you who are watching today, if you learn of new measures, we certainly welcome an email to the Policy Center at any time, and we would gladly be tracking the availability of those data sets going forward. But thank you for raising that really important point. And I'll just reemphasize that we truly believe that community-based organizations are a critical part of the health delivery system, and that community-based organizations, many don't want to provide free services and sort of barely get by right through volunteer services or chase grants, which for so long has had to happen. Instead, to support them in learning how to become providers, to provide these services with peer support specialists, for example, community health workers, therapists. Many nonprofits actually do provide therapy themselves, in providing them support to learn how to bill and become a part of the formal health delivery system, we think is critical. So I'll turn it over to you, Caitlin, to see if there's anything else you want to add.
Yeah, I would just say I wanted to flag that there actually is a call right now. It's due tomorrow, but there is a call to put in information for an upcoming CAP survey, so Consumer Assessment of Healthcare Providers and Systems Survey on maternity care provision. So it will really be one of the first national measures of experiences in maternity care in the US, and how essential it is to really lift up that included in that survey are the experiences of patients of color, mothers of color, and making sure that they feel safe in the system and what it means to feel safe in the system. So I would just encourage folks to submit comments on this. It can actually be submitted through the ARC website, and it is due tomorrow, but there is time.
The Agency for Healthcare Research and Quality is AHRQ, AHRQ, and the Policy Center did also submit some comments along with sister organizations that are addressing maternity care. So we've got much of that covered as well, but the more that AHRQ hears from folks, the better. That's great. That's a great example, Caitlin, of a new data set that could be available by this time next year, potentially, probably the year after.
Thank you. I think I'm going to turn this one to Katrina. We have one of our questioners wrote in who is a family nurse practitioner who points to the need for funding. That the biggest barrier is funding. What funding is available to providers to help expand these very important services for maternal mental health? And I know you touched on some of them, in your presentation. If you have others or you want to expand, please do.
Yeah, I think one of kind of the biggest area of funding right now that's open is under HRSA. They're allowing states to apply for more of this provider training work, as well as some additional elements too that can help kind of that care coordination. I don't think it necessarily includes direct service funding, but it could be helpful. So if you're not already connected to your state, working with them to apply, oftentimes they partner with universities. That's a good option there. I'm trying to think of other opportunities. There are some, each state has a mental health block grant that potentially could be used to help, particularly for communities who do not have insurance. So that potentially could be one. Usually the block grant is done through your state mental health director. So looking up through your state mental health director and trying to connect with them to get those expansive services. And then for maternal substance use disorder, there is a grant program out there to help any providers who are wanting to provide maternal substance use disorder at the residential setting. They just reauthorized this. This is regularly funded. That is another opportunity there.
Wonderful. I think we can do two more questions. I'm going to try and combine a couple around Again, around workforce, a lot of questions around growing the workforce and expanding it and making it more diverse and representative of the full range of patients that are treated. Joy, you spoke about doulas in particular and doula certification. How do we ensure that that is also, community-based and community-driven? And also, if you have any thoughts around, how do we ensure that social workers are also included in the slate of maternal mental health providers, and particularly around, there's a lot of concerns around the social work workforce is also not as diverse as we'd like it to be. Any thoughts on that?
Yeah, I mean, we really do believe that the federal government and Congress has an opportunity to lean in here. The Moms Matter Act, which Katrina touched on, a component of was addressed some initial funding for community-based organizations that was secured or passed last year. But there's more opportunity here to address diversifying populations, in particular of behavioral health providers. And the Moms Matter Act is being reintroduced by the Black Maternal Health Caucus and supported and endorsed by the Policy Center, as well as many other organizations in our space. So that's something we really would love to see some bipartisan support around. The doula work is really, the certification sits with states, with any professional, including peers and doulas. And so many states are working to certify peers and really to answer the question about certify doulas, to answer the question about sort of community-based doulas versus those who might sit sort of in more clinical settings or serve mothers in more clinical settings. The National Health Law Program and HELP is really leading the way on much of that work, and really is up to the individual doula as to whether they want to become certified and attempt to sort of anchor into an agency that's billing their services, or to be community-based and sort of use the sliding scale approach, which so many doulas are doing now, we know. So I hope I addressed the question, but NHELP is really the go-to expert on the doula workforce.
Well, I'm going to take, Joy, I'm going to give you the last word, and I like to end aspirational. And as such a longtime leader in this field, if you had that magic wand, we've talked about so many policies. If you could implement one policy change at the federal and state levels, what would they be?
Yeah, this is always a hard one. And you saw all of these critical policies here today. And I'm going to actually throw one out that I didn't address here today, but I think is really critical to solving our behavioral health infrastructure crisis in the United States. And that is addressing the issue of carve-outs. As many of you know, if you have coverage, your heart care coverage or diabetes care coverage or foot care coverage is covered under a medical plan. And largely, we all have to seek behavioral health benefits through a separate contract, through a separate entity. And for patients and providers alike, this provides significant barriers that just shouldn't be in place. And until carve-outs, and I use that term generally, carve-out means quite a bit, but until behavioral health really is administered through insurance in the same way it is administered and covered as medical conditions, we're going to continue to have to jump through hurdles. We're going to continue to have mental health parity legislation. We're going to continue to be struggling in the field of maternal mental health in this broken system. So I would wave that wand and see carve-outs go away. Thank you for that important question, Usha.
Well, I know we could keep talking, and this work continues. We all know that. So we are at time. I want to thank all of today's speakers, and on behalf of the Policy Center for Maternal Mental Health, thank you to all who attended today, and for your ongoing commitment to maternal mental health.
Thank you, everyone.